Hi everyone, my name is Annie Ronning. I am a graduate student at San Jose State University, and today I will be discussing cultural competency in athletic training. So what is an athletic trainer? As the picture states, I am an athletic trainer, and that title has many meanings. But to keep it technical, the National Athletic Trainers Association, or NATA, defines certified athletic trainers, or ATs, as healthcare professionals specialized in sports medicine services like primary and emergency care, injury prevention, clinical diagnosis, therapeutic rehab, and more. When you think of an athletic trainer, sports might be the first thing to come to mind, but athletic trainers care for more than just athletes. They care for people like your cousin in the Army, your uncle that's an assembly line employee, and your grandparent that just received a hip replacement. They can be found in a variety of areas outside of sport, including all of the settings shown here, and they're more than just an athletic trainer. We must address the need for adding cultural competence coursework as a standard for all educational programs in order to better the experience of every patient population. As we can see in this graphic, athletic trainers wear many hats. Studies have found that athletic trainers play a significant role in patient counseling and social support extending well beyond physical injuries. They are influential of the athlete-patient experience, and due to a lack of resources within sport, ATs often act in various supportive roles like mental health liaisons. Athletic trainers spend a significant amount of time with patients and play a vital role in their overall well-being, presenting the need for further improvement in multicultural education to better these skills and abilities. Currently, several governing bodies of athletic training do not address curriculum or assessment requirements centered on multicultural studies in comparison to other assessments like the MCAT for medical school. The 2020 educational standards is lacking cultural competency in its entirety. Without the explicit requirement of cultural competence as a standard, this essential component of learning becomes optional and is left out of many programs. The choice of optional is simply not enough. Cultural competence in athletic training is defined by Keisha Harriel as an ongoing process that enables healthcare providers to provide cross-cultural care that is respectful of and responsive to individual patient preferences, needs, and values, such as what's presented here in this graphic. The literature has repeatedly shown the need for further education within athletic training. Several studies highlighting both certified athletic trainers and students revealed good levels of cultural awareness, but a majority of participants did not believe they had the adequate knowledge to properly counsel athletes and provide culturally competent care. In other words, they had a degree of cultural competence, but were not able to implement it. So I ask, what good is the possession of cultural competency and awareness if it's not actually being practiced to improve patient care? A majority of athletic trainers throughout these studies did not have any form of cultural sensitivity in their curriculum, compared with nursing students where about 84% were taught cultural content. Research consistently indicates that multicultural education and intelligence can positively transform both patient and practitioner experience. Such benefits include improving patient outcomes and enhancing critical thinking skills of athletic trainers. It's important to note that as of 2020, 80% of NATA members are Caucasian, while the patients they serve are incredibly diverse. This is a prevalent disproportion within the profession, and in addition to diversifying recruitment efforts, a clear need for multicultural education exists. The current Bachelor of Science program is making a nationwide transition in 2022 to a master's program. And this provides an excellent opportunity to change the curriculum and make it a program standard to include specific coursework on cultural competence directly related to athletic training, though it has yet to be done. The NATA Ethnic Diversity Advisory Committee has made great strides through the implementation of mentorships, scholarships, diversifying recruitment efforts, and cultural awareness professional development opportunities. In addition to these optional efforts, required multicultural coursework within the MS program will allow for fundamental education and exposure for students. Evidence-based curriculum recommendations, such as what's presented here by Geisler and colleagues, allow an exploratory framework for programs to follow and adapt to best practices within their institution. Athletic trainers do not only work for athletes, but they work for everyone. They have the opportunity to play a significant role in their patients' lives and an ethical duty to do so in the best way possible. By better understanding the diverse patient population they work with, they can offer inclusive and meaningful care to every individual. This will not only improve patient experience like respect and trustworthiness, it'll provoke deeper thought within athletic trainers as they continually work on cultural intelligence throughout their careers. As Geisler stated, athletic trainers cannot be just athletic trainers. Rather, athletic trainers must actively seek to become global citizens capable of communicating with and understanding a vast diversity of voices, opinions, experiences, and worldviews. Thank you for coming, and I will be open for questions.